Choking for adults and children. In the United States, thousands of people choke to death annually. Choking is most often caused by food blocking the airway. The best treatment to dislodge a blocked airway is to let the person cough the object out on their own. A person who is truly choking cannot breathe, cough, cry, or make any sound. Most people that are choking will grab their throat. This is called the universal sign. By knowing one simple technique, the abdominal thrusts, you can prevent a choking incident from becoming fatal. When performing abdominal thrusts, you are pushing in and up against the diaphragm. This causes the diaphragm to push up against the lungs, forcing the object out. In most cases, you can force the object out within 3 abdominal thrusts. If you think a person is choking and needs your help, ask them, "Are you choking? Do you need help?"
Are you choking?
If no noise is coming out of their mouth and they shake their head yes, you will need to perform abdominal thrusts. Depending on the size of the person, firmly stand or kneel behind them with their back against the front of your body. Put both arms around the person's abdomen. Locate the belly button. Place the thumb side of your fist just above the belly button and your other hand on top. Give quick inward and upward thrusts until the object has been dislodged and the person can breathe, cough, or speak. When a child is choking, use the same technique as adult choking. If the person becomes unconscious, lower them to the ground. This can be challenging depending on how heavy the person is. The best technique is to lean the person against you and slowly move backwards, allowing the person to slide toward the floor until they are flat on their back. Have someone call 911 and get an AED if this has not yet been done. If you are alone, you will need to call 911 and grab the AED. Begin the steps of CPR. Bare the person's chest and provide 30 chest compressions. Then, open the victim's mouth to look for the object. If you see the object, remove it. If you do not see the object, do not put your fingers in the person's mouth. This is known as a blind finger sweep. A blind finger sweep could push the object further into the airway. After checking for the object, open the person's airway and attempt 2 breaths. If the first breath does not inflate the lungs, retilt the airway and attempt to give a second breath. If no air goes in, continue this sequence of 30 compressions, looking for the object, and perform 2 breaths until EMS arrives, an AED arrives, or the person shows signs of life. Special considerations with a choking person. If a person is pregnant, in a wheelchair, or you are unable to get your arms around their middle area, perform chest thrusts instead of abdominal thrusts. Stand behind the person. Put your arms underneath their armpits and place the thumb side of your fist on the lower half of the breastbone, center of the chest. This is the same position as CPR compressions. Pull straight back to give chest thrusts. Continue until the object is dislodged or the person becomes unconscious. If the person becomes unconscious, start the steps of CPR for a choking victim. If you are alone, find a table, chair, or firm surface and put your fist slightly above the belly button. Lean over the surface to force the object out. Anytime a person has truly been choking, they should be seen by a doctor.